Hello and welcome to Pharmacology 102. In this lecture, we will be learning a little bit more how drugs actually work. So let's look at ADME. So remember, we have four basic processes that happen within our body, and they basically apply to each drug or each substance that enters our body. So the acronym ADME is going to stand for absorption, distribution, metabolism, and elimination. So previously we talked about absorption. Let's talk a little bit about distribution. So distribution is the process by which the absorbed drug is going to move into soft tissues or basically other areas of the body. And where is this drug coming from? It's coming from the systemic circulation. So different factors are going to affect distribution of drugs. So some of these drugs are going to be intrinsic properties of the drug itself. For example, how big is a drug? What is its molecular size? What is its lipid solubility? How ionized is it? What is its cellular binding, or how long does it last? What is its duration of action? Versus other will actually relate to the body where the drug distributes, and this is going to be vascularity. So what's the underlying vasculature? What are some of the transport mechanisms? Are there any blood barriers? For example, if a drug is trying to distribute into the brain, there's a blood and brain barrier there. What are some of the drug interactions with other drugs and disease states? For example, in diabetes, there's a lot of microvascular complications, and some of the blood vessels can be affected. So if a drug is trying to distribute somewhere, that can be a problem. Also, you need to be aware of what is distribution equilibrium. So that's basically going to reflect the rate of the drug entry into the tissue as well as the rate of the drug exit. And C plasma is going to reflect the concentration of the drug in tissues and also in extracellular fluids. What you have to understand is that distribution is a dynamic and it's an ever-changing process, meaning that the way it happens, you don't just have a drug that goes through stages 1, 2, 3, and 4 consecutively. So you don't have something that's absorbed, distributed, metabolized, and then excreted. All of these processes sort of happen simultaneously. So the drugs are metabolized and excreted simultaneously. Drug concentration in the body is constantly changing, and this is primarily due to elimination. So as soon as you are going to absorb the drug, it's going to start getting eliminated. And this flux is what makes it very difficult to actually calculate the volume in which a drug is going to go or where the drug is going to distribute. So how do we define drug concentration? So the drug concentration will be defined as the amount of drug in a given compartment, and it's going to be defined in liters of amount of drug per volume where the drug is distributed. So for example, milligrams per liters or grams per milliliters. The volume of distribution is an important parameter for us to understand. Why? Because it will help us to determine appropriate drug dosing regimens. You have to understand that volume of distribution, it's not a specific number. It doesn't actually refer to any physiological compartment. So it's not like the volume of your leg or the volume of your GI system. It's not a physiological variable. Rather, it's a hypothetical variable that basically indicates the extent of drug distribution and will help you determine dosage requirements. So generally speaking, let's say we have a drug like digoxin that has very large volume of distribution. So perhaps you might need a larger dose to achieve a therapeutic effect that you're trying to achieve that's clinically significant. So let's talk about volume of distribution. I already mentioned that it's a theoretical variable, and one way that we can calculate the apparent volume of distribution in a body is by measuring a plasma concentration of the drug as soon as we administered it intravenously. That concentration is going to be known as C naught. So the way that we could calculate the volume of distribution is by knowing the amount that was administered and then measuring the initial intravenous concentration. So that will basically give us the volume of the distribution. And understand, like I said, that volume of distribution basically represents the size of the compartment that's going to be necessary to account for all of the drug as if it was distributed or dispersed throughout the same concentration as it is in plasma. So, to understand how distribution works, you must have a basic understanding of body fluids and tissues. So, you have to understand that our body is made out of water, literally. So, this is total body weight, and you can calculate it total body weight for somebody who's our typical standard patient, somebody like a 70 kilogram male. So a 70 kilogram male will have approximately 40 liters worth of body water. And how did I calculate that number? I just simply multiplied the body weight of 70 kilograms by 0.6. So you need to understand that our total body content can be basically divided into intracellular fluid, and this accounts for approximately 35% of fluid. This is a fluid that is inside your cells. And then extracellular fluid is going to account for about 25% of fluid. And this is a fluid basically everywhere else. These percentages are for adults, and they might be slightly different in children or adolescent patients. And then the extracellular fluid is going to be made up of plasma, and it's also going to be made up of interstitial fluid. Interstitial fluid is basically the fluid that surrounds the cells outside of the vascular system. So let's say we have a really large volume of distribution that's much greater than 40 or 50 liters that we actually calculated. What does that tell us? That tells us that the drug is probably going to be concentrated in tissues, and it's outside of the plasma and interstitial fluid. So if a drug is going to distribute extensively into the tissues, the volume of distribution can be calculated from plasma concentrations, and that could be much higher than the actual physiological volume into which it's going to distribute. So what do I mean by that? So for example, digoxin, and we talked about digoxin before, it's a drug that has been used for congestive heart failure. This one has a volume of distribution approximately 440 liters in adults. And, obviously that's much greater than any physiological volume of a human body can be. And that's the reason for that is because digoxin extensively binds to muscle tissues. So the plasma levels are going to be low in comparison to concentration actually in muscle tissues. Phenytoin is going to heavily bind to proteins. So drug protein binding, you need to understand that can affect drug concentration as well. Phenytoin, we use it in compound wound 81 because it helps stimulate cellular growth. So we use it in wound preparation, but it's actually a medication used for seizures. And you can see that in order to adequately calculate the proper concentration of phenytoin, you have to account for albumin, which is a protein that phenytoin is going to bind to. It's also very important to distinguish between blood, plasma, and serum. So blood is basically going to refer to the fluid, and it's combined with different formed elements. What are formed elements? These are white cells, red cells, and platelets. So then plasma, right? So plasma is going to basically refer to the fluid portion of the blood that includes soluble proteins like fibrinogen, but it does not include formed elements. So you see plasma contains fibrinogen, but it does not contain formed elements. These are separated. And then serum is actually when you take the soluble protein fibrinogen out of the plasma, you're left with serum. And basically what fibrinogen does, it's actually a glycoprotein in our body that helps form blood clots. But you need to be aware of the difference in biological fluids when you're thinking about different drug concentrations, because let's say you have a drug that's going to concentrate in red blood cells, then if you measure its concentration in plasma versus its concentration in blood is going to be much different. The last two processes that we're going to talk about is going to be metabolism and excretion. So metabolism is basically the process by which drugs are metabolized. So here you have a drug codeine that's being metabolized to a drug morphine, and this is done via a chemical reaction that's called O-dealkylation. O-dealkylation is just basically an organic reaction that happens. It's a reduction, oxidation reaction, and basically you have the alkyl groups that's being lost, and you have a hydroxyl that's in place. So via chemical reactions, these are how drugs are metabolized in our body. And who actually performs that job? Who performs that function? This is done via enzymes. And what are enzymes? Enzymes are basically nature's powerhouses. They are proteins in our body that are going to catalyze or facilitate biochemical reaction. And you need to understand that this is going to happen via biochemical reaction. So for example, here you have glucose that's been metabolized to glycogen, and all of these actions are being performed by enzymes within our body. So when you talk about enzymes, you need to understand that there are three different key terms that are very important for your knowledge in order to understand this entire process. I will talk more about them in the next lecture. Thank you so much for your time.